Welcome to Nursing Simplified with Nurse Jane, the smart way to survive nursing school. Hey there, nurse rockstars. Today I'm about to make ACE inhibitors your new best friend. Let's get straight to it, the simplified way. So what are ACE inhibitors? Let's break down that fancy name. ACE stands for angiotensin converting enzyme inhibitors. These meds help your blood vessels chill out and relax. Picture them as a spa day for your arteries. Some familiar faces in this family? Lisinopril, enalapril, and captopril. Quick tip. If the med ends in pril, you're probably looking at an ACE inhibitor. Remember that for your next med pass or exam. Alright, let's dive into how they work. Imagine your body's got this super grumpy landlord called angiotensin II. He's always tightening the pipes and jacking up the rent, aka your blood pressure. ACE inhibitors step in and say, nope, not today. They block the creation of angiotensin II. Your vessels relax, your blood pressure drops, and your heart finally gets to take a breather. But why do we love them? Let's talk uses. ACE inhibitors are all stars for lowering high blood pressure, treating heart failure, helping out after a heart attack, protecting kidneys, especially in patients with diabetes. Alright, now for the not so fun part, side effects. Here's the best way to remember them. Just think ACE. A is for angioedema. This is serious, swelling of the lips, face, or throat. If your patient suddenly looks like they're having an allergic reaction, don't hesitate. Call 911 stat. C is for cough. That annoying, dry, never-ending cough. Annoying for your patient? Absolutely. Dangerous? Not really, but still, let the provider know. E is for elevated potassium. Too much potassium can throw the heart out of rhythm, so watch those labs, especially in patients with kidney problems. Alright, quick-fire safety tips. These are your go-tos for the floor or clinicals. Check blood pressure before you give an ACE inhibitor. Keep an eye on potassium and kidney labs. Remind patients to rise slowly. No one likes a surprise head rush. Tell them to avoid salt substitutes. Most are loaded with potassium. And always watch for that cough, elevated potassium levels, and especially angioedema. If you see swelling, that's an emergency. So there you have it. ACE inhibitors, the Nursing Simplified way. Short, sweet, and stuck in your brain with that ACE trick. You've got this. If you liked this video or you learned something, please consider subscribing. It would mean the world to me. And remember, nursing is a work of heart. I'll see you in the next video. Bye-bye.